This is Henry Sanders back with another episode of Real Talk. Well, it's actually a special episode because we are announcing a special partnership here to help some of us get tested. When I say some of us, I'm talking about black and brown folks, people look like us, get tested. So when I said us, that's exactly what I meant, us. So we have two of our partners here. As always, my man, MJ, Michael, Jordan, Jackson, Johnson, choose one, my man. How you doing, bro?
I'm good, man. Really excited about putting this in the community. Appreciate partnering with you all on this.
Yes, and our friend Aurielle Smith over there. So it's the Public Health Dane County / City something, right? What is it again?
You were so close. So I'm the Policy Planning and Evaluation Division Director for Public Health Madison, Dane County.
That's still a lot to say, but look, we're just glad there's a black woman up there. So look, I don't know what you just said, but good. I'm glad you were there helping our people. So thank you.
Hey, but Henry, her boss told me her official title is COVID-19 Commander-in-Chief. So that's what I'm going to call her. She's the Commander-in-Chief.
See, that's simpler too, right? Like, let's get right to it, right?
I might keep it after COVID. Who knows?
Let's just say that the Commander-in-Chief COVID-19. That's all we got to say. Thank you, MJ. So we are excited. We're excited that we are trying to focus intentionally to reach people of color. We are not excited that we have to do this, but we are excited that we are intentionally reaching out to people of color across the county. And so which one do you want to start talking about this? Is Aurielle or MJ? Who wants to start about what we're doing and why we're doing it?
I think the best looking person should go first.
The Commander-in-Chief? The Commander-in-Chief?
Flattery will get you both everywhere. So, yeah, so we're doing this because we recognize that there are some big disparities and gaps with our people of color and white folks between testing and outcomes in regards to COVID-19. And so with that recognition, we are doing some community pop-up testing to get into the neighborhoods, to go into these centralized locations, to make testing accessible and then also culturally competent, right? So for all of us who are out there who are like, well, what is this test again? And what's being shoved up my nose? And how do I know that this isn't going to end up like a Henrietta X situation, right? And so, we're here so that it's a little bit more of a community feel, not so much of a clinical field. So that we're here to answer questions. We're here to talk you through what is COVID. We're here to make sure that you get connected to the help that you'll need after you get your results, whether they're positive or negative, right? There's follow-up for both, and I think that gets missed in a lot of things. And so we're partnering with amazing community organizations such as Boys and Girls Club of Dane County to make sure that we're putting on these sites, that they're meeting the cultural need, that they're meeting the community need, and that we are doing our due diligence as Public Health Madison, Dane County.
Yeah, well, thank you. MJ, so when we first started talking about this, I know it's real important for us to get in the community. And right away, when we're starting to figure out where do we do these things, we came up with places right away. So we talked to Northport Packers with Pat over there, Juankin and Carmen Porco. We talked about Lighthouse with Pastor Marcio Sierra. I know we're going to start. The first one is going to be at the Boys and Girls Club, I think, in Allied, right?
Yeah, Allied Drive on Tuesday.
So we really intentionally spread out across the county where we know there are pockets of people of color, hoping that they'll come out all days. Each one's from 1 to 7, right, Aurielle? Each one's from 1 to 7.
Each one is from 1 to 7. There is one that's from noon to 7.
Noon to 6.
Noon to 6.
MJ, why don't you walk us through the dates and where we're going to be at?
Absolutely. So the first one is this Tuesday. So, hopefully, people will be safe, over the holidays and practice social distancing. And we just want to encourage everybody to come out. So the first one is going to be from 1 to 7 o'clock p.m. at the Allied Family Boys and Girls Clubs at 4619 Genuine Road. That following Thursday, we wanted to make sure that we connect to the Latino community. We're going to have a flyer that's in Spanish. We'll be working with our good friend Marcio over there at Lighthouse Church at 6402 Schrader Road. And that's also from 1 to 7 on July 9th. Tuesday, July 14th, we're going to be in Northport Packers. That's our Northport CLC at 1740 Northport Drive. We wanted to make sure that we had a location on the west side, a location on the north side, and those two meet those demographics. We also heard early on that folks from the Hmong community was concerned about getting tested. So we reached out to Ping Her, who's the president of the Hmong Institute. And so on July 16th, we'll be there between 1 to 7 p.m. at 4402 Femright Drive. And then that following Tuesday, July 21st, from 1 to 7 p.m., we'll be at the Taft Street Boys and Girls Club. We wanted to make sure that we had a location on the south side, of town. And then the final one would be Thursday, July 23rd at the McKenzie Family Boys and Girls Club. And we wanted to make sure that we had a site out in that location. Henry, let me just share one of the reasons why I wanted to work with with Aurielle and her team and Madison 365. Early on when COVID hit, I was really concerned about us having testing locations in communities of color. I mean, I was reaching out to people in New York. I was reaching out to different people who I knew that was creating these testing kits. And Aurielle, believe it or not, you saved us a lot of money because we were prepared to fundraise, and I was being told how much these tests cost, and we were prepared to raise a significant amount of money to make sure that people of color was being tested. Then we started seeing a disproportionate number of African Americans who were passing away from this. And it just bothered me to my core. And then I will finally just say one of my favorite rappers is a guy by the name of Scarface. Scarface was a huge rapper back in the 90s. I grew up on his music. He was part of a group by the name of Ghetto Boys. And Scarface was very, very healthy before he caught COVID-19. And now he's on dialysis, potentially, for the rest of his life, unless he get, a new kidney. And so I just want to just tell people to please know your status. Please get tested. If you have to get tested every single day, bring your kids, bring your family. And then what I'm going to do, I'm not going to announce it yet, but we're probably going to be giving out some cash rewards, some cash like incentives. I just want to we might have food out there. I'm going to come up with something creative over the weekend to encourage people to get out and to get tested because it's important.
Yeah, and going off of that, Michael, I mean, that's something we were having conversations about when we set up the Alliant Energy Center. And that first couple of weeks of operation, I recognized that we were just not seeing as many Black people in particular, but people of color at all, right? And so I'm so glad that you all kind of reached out to us at the same time where we were trying to seek some community partnerships as well to say, hey, we recognize that people of color are not coming to this site. Let's find out why and what can we do to bridge that gap? And I think we were able to rapidly turn that around. And we worked together to set up these community pop-up sites, and you guys picked some tremendous locations that are really going to meet that population need. And so, that's kind of the origin story, right?
But I got to tell you, Henry, when I walked into the Alliant Energy Center, I said, because you rarely see a Black woman in the Department of Health running things. And so they introduced us to Aurielle, and they were like, she's the head of COVID testing for the county. And I was like, whoa, I love it. And rarely, I don't care what city you in, rarely would you see a young Black woman in this space. And so I just want to say, I'm just proud of you. I'm glad that you're leading in this space, and I could feel your energy, and I could just tell that you really care about the welfare of our community. So I'm just glad to see you in that position, and let's just go out, make a difference, help a lot of folks, and make sure people get tested.
Yeah,
so
and the mayor, Sadia, County is at Parisi. When y'all have a Black person in a position like that, y'all gotta let people know, that is so important. Basic one-on-one outreach to the community. She gives a face and empathy to this. So like next time, don't have to search this out. Making sure that we know this stuff. I mean, we need like this. This is good for us. So what can people expect when they come? Like, I want to get past any myths that they have or any the things that they're scared about. They come. I haven't been tested yet. So like they come and what happens? They come and then what happens?
Henry, first of all, we got to get you tested, man.
Well, here's the thing, though. Here's the thing. MJ would tell you this. I've self-quarantined for real. Like, so, like, I don't see people, nothing. Like, because of my family situation, so I've really kind of been self-isolated. So I haven't.
Well, that's good. I'm happy to hear that.
We still want to get him tested.
Yeah.
So, but he is telling the truth. He probably has not seen one person face to face in about 3 months, and so so that I know is the truth. Because even when I came to his house to give him some face masks, he was like, "Just throw them in the mailbox and give me a call back."
That's true. That's real talk.
I feel like we need to put you on a poster for quarantine and isolation. So we'll come back to that. But what people can expect when they come to the testing site, right? So some myth busting. So I'll try to go over some of the frequently asked questions we get. 1, you do not need an ID. We are not checking IDs. We don't want to see your ID. We are just verbally taking the information from you. It's pretty straightforward information: name, address or place that you stay, phone number. If you don't have a phone, whoever is the kind of next of kin who can get in contact with you if we need to get you your results quickly. Some demographic information, right? Because we are tracking that because we want to make sure we are meeting the community need, right? So whatever you identify as white, black, Asian, Hmong, like we need to know that. And date of birth. Those are kind of like our key information questions. So you'll drive up, we'll take that information from you, we'll type it into our system, we'll fill out the form. You will either drive or walk along, depending on if you're doing a walk up in your neighborhood or you're driving up. You'll come to the specimen collection, which is the really like formal name for it, but it's where the thing's going up your nose.
Wait, stop. See, you going past. See, if I'm listening right now, that's what I want to know. Up my nose, like so. Because I've heard it goes like, people saying it goes back in your brain and it's all the way up. People hear all that stuff. So stop. See, you go on. See, you got kind of bougie on me for a minute. Like, you got to rip real quick. Like, what does that mean up the nose? Well, like, break that down for me.
So it goes up your nose, and I will have Michael attest because he's been tested too. So it goes up your nose. It goes to right about here. Okay. And I will say, and Michael, you can maybe test this out and tell me if I'm doing a good job. The staff that I've recently trained who will be doing our community pop-up sites, they're mostly our staff or some of our partners from University Health Services from UW campus. I've trained them in a much more gentle technique. So our friends at the Alliant Energy Center, they can be a little aggressive. So we've taken a gentler approach to still kind of go up the nose so that it's not as like, ooh, it's a little shock to the system. So we've changed that process, but it goes right about here. Okay. It's a little twirl. There's no like big swirls. It's not going all the way to the back of your brain, and it does not hurt. I can say that as I got tested this morning.
If MJ can do it, MJ's a wimp, right? So if MJ can do it,
me.
Yeah, big teddy bear.
Yes, they put in my note. They had to move some of the boogers out the way, but then when they got the boogers out the way, they were able to go in. And actually, it was ticklish to me. I started laughing, and I ended up crying. And I wasn't crying because it was hurting. It felt like somebody was tickling the bottom of my feet, and I couldn't stop laughing. So it was literally, I would say, 2 minutes, if that, from the time they asked you the questions to the time they moved the boogers away from your nose and stick the little thing, the nasal swab, and that's it. And then I was sitting at home. I think this was a Friday, if I recall. Mm-hmm. I was sitting at home on a Sunday afternoon in my backyard, and somebody called me. And they gave me my results, and my heart I'm being honest, I was like, oh shit, excuse me. I should have said that, oh shoot. So, sorry about that. I forgot. We, Madison 365. I'm so used to talking to Henry in private. So I was sitting there, And I was like, oh my God. And they told me I was negative. And I'm so glad I did it, right? And so, but I will tell you, I got people in my own family that was like, I'm not getting tested. I don't know if, and people got their own rationale. And I just think we just got to know our status. I just seen a young sister from Madison yesterday in her hospital bed, literally in tears. She didn't believe that Black people could catch COVID. She talked about how she caught it and was literally on social media yesterday begging people to get tested, to know their status, and to take this very, very seriously. And this is a young woman in her 20s, very healthy. So please, guys, take it seriously.
Yeah, and with that, I will say our current individuals who are testing positive, like in high rates, has been our young people. That 20 to 29 age group has gone up exponentially in the last 2 weeks. And so we are really trying to make sure that our young people are getting tested as well, and trying to do some more positive messaging around getting tested and wearing a mask when you're in public, or wearing your cloth facial covering, so that they can feel empowered to do so and keep themselves safe.
Do you guys give out masks?
We do. So we have masks available, and we will continue to have masks available for everybody who wants or needs one and comes to the testing site. Right now, we have a great supplier, and I'm hoping we can keep them because they actually pre-package them in packs of 3. So we just give you the entire pack. So that way, if you come across anybody in your family or any friends that don't have one, that you can just hand them out too.
And how long does it take to get the results back? I come July 7th at Taft, Allied Boys and Girls Club. I get tested, 2 minutes up my nose. I go home. How long do I have to wait before I get the test results?
So it takes about 3 to 5 business days, but I will say we've been turning them around. Hopefully I'm not jinxing myself, but we've been turning them around pretty quickly. I mean, some people are getting results back in 48 hours. Okay. But on the safe side, because I know that the lab we're using Exact Science, which is local, and trying to support them. They're getting a lot of tests lately, so we give that 3 to 5 day window just to give ourselves some cushion.
Henry, sorry, go ahead, Henry.
And if I'm test positive, then what happens?
So if you test positive, we from the health department will be calling you. We do not stop calling you until we've made contact to let you know that you are positive. We go over what kind of I'm going to use a bougie fancy word, so bear with me, what isolation procedures are. And what that really means is we are giving you all the tools and resources you need to stay in your house and stay away from everybody else. And so right now we're actually financially supporting people as well who have to isolate. So we're giving out gift cards and making sure that they have groceries and doing things like that. Because we want to really empower people, if you are positive, to stay home until it is safe for you to kind of be back out in the general population.
That's awesome. MJ, you had a question?
So if somebody tests positive, I actually just made a Facebook post about this because I learned yesterday that there was somebody that was positive and still going out, in the community. And what I heard was this person was saying, well, I got to go still get groceries. And so what would you do to advise that if somebody's positive, how do they handle that? So somebody go get it, or can somebody deliver groceries? I would just love to hear your perspective on that.
Yeah, so I think we've done it in a couple of different ways, and it all kind of depends on how comfortable people are. So we are able to offer, I think they're Visa gift cards for groceries and things like that, because we recognize some grocery providers are able to do grocery delivery and things like that. And so by having that Visa gift card, they're able to kind of type it in like a credit card, and it can pay for the delivery fee and all of that. We have also been able to support individuals who have neighbors and friends who they've let know that they're positive and are staying isolated, who have reached out to us and asked, well, how do I get this person supplies and do it safely, right? So we've walked people through, if you're going to buy groceries for them, for example, it's okay for you to go to the store, and then you're going to want to leave them on the step and call them and say, hey, I'm leaving your groceries. I'm going to back away now. I'll wait down the street, right? I'll wait on the sidewalk until you can come get them. And then we instruct that person to wipe down everything that comes into the house. So wipe down the boxes, and we give them sanitation supplies and things like that.
Is there a maximum dollar amount, Aurielle?
He's about to find a way to give money. Look at him. I can see it in his eyes. I can see it.
We got to announce that, let people know that this is a research.
Well, and that's also something we're really pushing for. We just had a great conversation with the federal government a couple of days ago, and they just point blank asked us kind of what support do we need, and we said we need additional funding to continue past December 31st of 2020. Right now, that is the only federal, like all of the CARES funding, all of the COVID funding has an expiration date of 12/31/20. And so that was our point blank ask to say, we in public health, we are telling you, we are going to be in this and the residual effects are going to be here past that date.
No question.
So we need funding that allows us to be flexible, which I think they've done a great job of doing, and will sustain us past that date. And so for us, I know we're trying. If we had that opportunity, we wouldn't feel that we have to ration so much to try to get us through December.
But that's a good point. You guys got, $95 million to do from the CARES Act to do stuff like this. Are they flexible or are they rigid? Are they pretty flexible how you spend the money?
Yeah, so they're pretty flexible. And I will say there's a little bit of a difference between the CARES funding that we at Public Health Madison Dane County got, because ours comes directly from Wisconsin Department of Health Services. So there's a little bit of a trickle down CARES funding there. And that's separate from what the county received from its $95 million. And so we have also been having a lot of conversations with county leadership as to how do we maximize those dollars, and we're not like duplicating efforts, and we're filling the gaps right from the public health funding and what the county can support, and kind of vice versa, to make sure that we are really utilizing these in an effective way to serve the residents of Dane County during this time.
Got it. That's powerful stuff. So, okay, people, get tested. Starting next week, Tuesday, July 7th, it starts, and we're starting at the Allied Boys and Girls Club. If you're on the north side, we're coming over there to you on the north side Packers, right across McDonald's, right across from Warner Park. Go over there. And what I love about Northport Packers is it's extremely diverse. So shout out to Carmen Porco, shout out to Pat Wonkit over there for letting us come over there. If you're on the west side, go check out us at Lighthouse with our boy over there, Marcio Sierra, and get out there. And then we have two more, one at the Taft Boys and Girls Club, and then one at the Sun Prairie, with Sun Prairie, people sleeping up Sun Prairie. Sun Prairie has a big population of people of color. Actually, percentage-wise, they have more black folks than Madison does, percentage-wise. So make sure that you get out there at the McKenzie Boys and Girls Club and get tested, folks. It's for real. It's killing our people. Our people are getting sick, but it's killing our people. It's killing black and brown people. It's not a game. It's not a joke. It's not something you should mess with. And yes, black folks and brown folks can get it. And I'm telling you right now, Google it. And we are dying from it. We are dying from it. So get tested. And if you are test positive, stay positive. Literally stay positive. But do the things they're asking you to do to isolate yourself. It can help and save your life and save people around you.
Yeah, Harry, if I can, you're spot on. I just want to just give kudos to my team, Dr. Sarah G. and Laura, who's our Chief Development Officer. They were up the other night until I think 1 o'clock in the morning, working on this. And so I just want to just publicly thank them, because they've been working with Aurielle and her team. And Henry, I just want to say thank you for, partnering with us on this. And then to our Commander and Chief, we appreciate you. We're here to follow you, ma'am. Just tell us what we need to do, and we're at your service.
For real.
I like it. Oh, I'm going to get used to that. No, and thank you all so much. I mean, we wouldn't be able to do what we do at Public Health without the community engagement and community input, right? And so you are just as much a part of the team as we all are. So together, we are going to make sure that this doesn't knock us out as a people.
And we appreciate how many people are we averaging a day?
300.
All right, so our goal at the one that we're doing, we need an average of 500 a day. And we're going to figure out some sort of incentive to make sure we cannot let anybody beat us out. So how many sites is that? 1, 2, 3, 4, 5, 6, 500 a day. And so what's that, 3,000? Is that my math right? Yeah, 3,000 people. That's what we need.
Here we go. See, Aurielle. See, it can never be simple, right? It can never. It can never be simple. People, and this wasn't scripted. This is MJ. This is typical. Like, and he means it. Like he means what he just said.
He means it.
And that when we get off this, he's gonna try to make this happen.
Even if he's got to be 50 of them, he's going to do it.
He will. See, Aurielle, you get him. I see you paying attention.
I see him.
You paying attention to him. You getting.
Hey, the more people we can get there, the more lives we probably can save.
That's true.
And it's not just about getting tested. It's about people knowing their status so they can quarantine so they don't cause harm to other people. Mm-hmm. And I just think like what we're doing is it's important. And I just don't. And let me also say, more than people of color can come. So if you're white, you should be able to come to these too. We're just moving them into the neighborhood because there are barriers to people of color getting into these sites. And let me tell you, if transportation is an issue, call us and let us know, and we'll figure out a way to get you there.
See, now Aurielle has to go. See, I see she whispers something on the side. Someone got to go.
I saw
see,
that.
MJ just taking up. See what I'm saying?
I'm sorry.
No worries.
See, you better respect the Commander-in-Chief's time. Respect their time.
That's right.
Respect their time. But again, thank you for everyone. Come on out, and I'm hopefully, if we need be, I'm hoping that we're going to do this beyond next week, and hopefully that we'll continue to do it throughout the summer to help reach people. As my guess is the numbers going to keep going up. As my guess, I could be wrong, but thank you for everything you're doing. Thank you, Commander-in-Chief, for joining us, and we'll see you soon. MJ, my man, always.
No doubt.
Thank you.
We'll see you next time in episode Real Talk. Thank you.